Well, craniomandibular dysfunction is something like a general disease. There are lots of causes outside of dentistry, and the dentistry is only one out of many risk factors to develop CMD, craniomandibular dysfunction. First, CMD means spasm of muscles of the musculatory system in the face and neck area. Again, there are lots of risk factors, but one risk factor in dentistry is, for example, malocclusion. Malocclusion has a big influence on the chewing system, on the muscles, and so it might develop CMD, and CMD is a risk factor for other diseases like headache, like tinnitus, like backache, for example. And until now, the role of dentistry was not very well known in this field of medicine. And fortunately, in our university, University of Greifswald in Germany, we do a lot of research, of epidemiological research, and our brand new research proves even scientifically that there are very strong connections between dentistry and the diseases I just mentioned. Trigeminal neuralgia, migrainous pain, I might add, as well as tinnitus and all these things. So that's a big field in research. In my former time at Göttingen University, we had casuistic. We had from time to time patients where dental treatment was helping, but we had lots of patients where it did not help, because at that time we didn't know that there is a multifactorial etiology of these factors. Now we know that, for example, headache, if patients suffer from headache, and other disciplines can be responsible. If the other disciplines don't find anything, there's a 50% chance that dentistry finds something that might influence the disease in any way. So in general, we can say that the role of dentistry is now more important in general medicine, because until now dentistry was, for me, too far away from medicine. And now we say a speech in Germany is dentistry is medicine, so it's part of medicine. And now we have very good cooperation with neurologists, for example, with ENT doctors, and they send patients, we send patients. There's a good cooperation due to our scientific results. They're very important, and it's very important what we do in our CMD conferences in Germany, which we organize. I was for many years president of the scientific community of German dentistry. I try to get general doctors, physicians, and neurologists and ENT doctors to our, or orthopedic doctors, to our conferences. And it's not so easy for dentists to get them, but more and more come, and we are on a good way. My personal aim is to show dentists their role, our role, I'm a dentist, to show them our role within medicine. So they go by themselves to a neurologist, and they're self-confident, because until now many dentists in Germany, they are not very self-confident against physicians, because they think that they are second-class doctors or something like that. That's not right. So we are the biggest discipline within medical disciplines, and I mean, in some parts it's our own fault, because unfortunately, many dentists in Germany, they are only working in fields of bleaching, of cosmetic, aesthetic, and they are not working in the field of general medicine. And even their advertisements on home pages or in TV or wherever is only dealing with white teeth and all this stuff. And it's not enough. We have a very big medical responsibility against our patients, and dentistry is very much more than cosmetic. Of course, cosmetic is part of the game. Who else but we should bleach teeth or give white teeth, nice smiling, but it should not stop there. We should continue with, I mentioned headache, earache, and all these things, and that's the aim, my personal aim of CMD conferences like the one that's planned in October in Kaunas and other things. So again, I think it is very important, and I invite all doctors, dentists, and general medicines and physicians to this conference, because I think it is very, very important in our role, in our general responsibility we have for our patients. And so I hope that lots of people will come to this interdisciplinary conference, dentists as well as physicians, and I would be happy to see as many as possible.